If you've ever had vertigo, you know how it is more than just dizziness. It can really complicate your life. The story that I'm going to tell you today is about a woman who was getting desperate because her vertigo kept happening, and it made her look outside the box, even though she was skeptical. Hi, I'm Jenna Quinton, founder of Adjust Your Media and host of What Chiropractic Doesn't Cure, Stories of Innate podcast, and I'm eager to share this episode where we also get into what we wish more people understood about health and healing. And stick around to the end because there's a special message for moms. So look in the show notes for all of the details and more information, and let's get started. So today on What Chiropractic Doesn't Cure, Stories of Innate, we have Dr. Kyle. Okay, I'm going to restart that because I did not say your name first.
Just let it flow.
Kyle Cavitt.
Keep this. This is going to be the best one.
Okay, so today we have Dr. Kyle Cavitt. He's a chiropractor in Oklahoma, so welcome.
Thank you.
We met recently and you were willing to come on and share a story, which I think is always so fun when, I don't have to go look for a story. The story comes to me. So what is your story today of someone whose life was improved with chiropractic care?
Oh my gosh, there's so many to talk about this week. I truly have been blessed. I would say one that's on my heart right now is a beautiful young lady came in yesterday. One of those people that are very skeptical about chiropractic, right? In this day and age, everyone wants a fix-all, a cure-all of being able to help with anything. But people are skeptical, especially whenever it comes to chiropractic. But she came in with balance issues and vertigo, and she actually has a cochlear implant, and had no idea why her friend would send her to a chiropractor because she had no problems with her spine or her neck. Mm-hmm. And just sitting down with her and hearing her story and hearing kind of what she was going through, I, first of all, had to establish trust and rapport that in the right place, and that we actually specialize in extremity adjustments. And I see a ton of people for tinnitus or ringing in the ears, but also vertigo, balance issues, things like that. So after just one or two adjustments, she is singing our praises as far as she had no clue that chiropractors could adjust ears. So, so that was great to see. That was very, I don't want to use the term that you get used to it, but it's always great to see those people have that aha or that epiphany. Oh my gosh, like I can be helped, because a lot of people start to identify with their problems, their health problems. So it's great to see that, and it's good to let people know that chiropractors can help with that.
Well, and like you're talking about, just we start to accept our own limitations, and we start to think this is the way things are. And so I need to figure out a way to live with it. I need to figure out a way to just go with it. I think about one time that I had vertigo. We were on a road trip and it was my turn to drive. And I was like, I will not be driving. We were somewhere in Kentucky, and it was a few years ago. And I wish that I had just had the nerve to say, I'm going to find a chiropractor anywhere around here, interview them a little bit, find out what they're about, but just say, like, you gotta help me.
Yeah.
Like, I am stuck in this minivan with 4 kids. Like my head is spinning.
Vertigo inside my head is killing me.
Yeah, exactly. And how life-giving it is. And also, my poor husband had been driving for 8 hours or something already. So we think maybe it's a small thing like, oh, you're dizzy, like you're fine. But how it ripples out, you can't drive, you can't stand up straight. You're trying to think through a simple math problem and you can't.
It affects your own name.
Yes, exactly. So it affects so many things. And yes, to start to accept the limits of, well, how can I work around this? And instead of finding a way through it, trying to find that workaround.
Yeah, I can't tell you how many times I hear in a day, oh, I thought this was my new normal, or, oh, I'll just put up with it. Like, people have this very weird misnomer of, because I'm getting older, I acquire health problems. Mm-hmm. Because I'm older, like, that means I start having health problems, when that's not true. But I completely agree with you. One of the craziest things is when people say, oh, you're just dizzy. And it's like, no, no, no. Vertigo is completely different. It's like a roller coaster you can't get off of.
Mm-hmm.
And it's completely different than, oh, I got up really quick, and my blood pressure dropped and I got just a little bit of dizziness. It's like, no, no, no. It's a completely different animal.
Yeah. Well, and I imagine for somebody who, like you said, has a cochlear implant, is already needing to deal with different situations and things and adapt and pivot to add another thing of like and on top of trying to hear well, I'm
Yeah.
dizzy. That can be scary too, to think like, okay, what else is going wrong if I'm having these symptoms?
Well, and not to blame the medical community, but it's just like there are those out there that are like, don't let a chiropractor touch you for this or for that. Like it could mess things up. So they're already put in that headspace of, well, I have this cochlear implant. I don't want you touching me because I don't want things to either revert back or I don't want things to get worse. And so don't touch it when it's just like, you do understand I can help and I can help you,
Mhm.
but you got to give me a chance, right?
Yes. Yes. So a couple episodes ago on the podcast, I interviewed a chiropractic patient who'd had spinal surgery. So if you look that up, it's Nicole Pukala, and she had had, major spinal surgery, Harrington rods and things when she was 15. And the chiropractor who was willing to give her the thorough exam to
Yeah.
see what he could do, to say this is a fact, you've had this surgery, you've had these things, but let's examine what we can do to help you. And I think that thorough analysis is what a lot of people don't understand also, is that you've been trained to take in the whole picture of the whole person and what they're struggling with and where they're at.
Yeah, absolutely. And I think that one of the main things that we battle on, I don't know if this is just in Oklahoma, but one of the things that we battle is the people that just want that. We live in a society we want instant gratification, right?
Right.
So a lot of people in our profession that came before us are started to get people to where, hey, just I want to walk in and get cracked. I want to get popped, right?
Right.
And a lot of times, whenever we say we're taking x-rays, we're doing a neurological diagnosis examination, so to speak. And they're like, well, can I just put me on the table? And I was like, don't you want your doctor to be thorough?
Yeah.
And especially when we get to the point where like, oh yeah, should I have mentioned that I have hardware in my spine? I'm like, that would be a very good thing to tell your chiropractor before
Right.
anything is done. And we're definitely taking x-rays. I don't know how they did it in the past with you, but this is who we are. We're thorough.
Yes.
And it's our reputation on the line. So I'm going to be a doctor. Okay.
Yes.
Right.
Yes. That's so great that you share that, because yes, I was getting my nails done one time and they were like, what do you do? And somebody another team member who worked there was like, oh, I'd love to go to a chiropractor and just pay them whatever it took to crack every bone in my body. And I was like, well, what you actually want is a chiropractor who's going to be so specific and find where you need to be adjusted.
Yeah.
Because like you mentioned, extremity adjustments, and that's such a cool thing to, like, my husband has a rugby injury on one ankle and he loves to have that be checked. But to have a chiropractor who specifically is not checking all of the joints, but says, ooh, that rugby injury, yeah, we're definitely going to give that some love and attention. To say, like, oh, look at your spine here, like on the x-rays, I'm seeing this happening.
Yeah. Well, and I think that's one thing that's great about chiropractors. And one thing I tell our patients is, listen, I'm not going to be disrespectful and say, hey, I'm just going to focus on your low back today. I'm just at your neck and then I'll get you out of here. I'm going to take everything into account, do a systemic approach, and I'm not going to compartmentalize like a mechanic would do, but I'm going to look at everything globally. And I'm going to address the hip. I understand that your pain may be in the ankle, but tell you what, let me work from the spine out and
Love it.
everything is good from there. And then I will eventually get to the extremity, but let me make sure everything weight bearing above that is good to go. And then I will get to the localized area that you feel, but let me check where that nerve travels first. right?
Love it. Yeah. And that's such a key thing for everyone to understand where that nerve travels. Like it's not just isolated there. We have a children's song that tells us it's not isolated.
Yeah.
Excellent. So I'm curious, how did you get into chiropractic care? What was your journey?
Oh my gosh. Well, I'll keep it concise. I was actually on my way to physical therapy school. I was actually doing prerequisites to get into OU, University of Oklahoma, for physical therapy. And I actually got, I know it doesn't look like it now, but I used to be in good shape. I used a personal trainer. But at the time, I was doing high end appliance install while I was doing my prereqs. And one day got injured on the job, and I was in peak physical, like just the best shape I've ever been in.
Yeah.
I couldn't even stand up. I couldn't even walk. And at the time at 22, they were like, your two options are either undergo this spinal surgery that's a coin flip 50-50 if it's going to work or not, or be on these highly addictive pain medication for the rest of your life just to be able to walk. And once again,
Yeah.
at that point, I'm like in the gym consistently. I'm playing soccer, weekend warrior, being active. And I'm like, that's just to be able to walk. Or my other option is a spinal surgery. You're not real sure if it's even going to work.
Hmm.
So, as many people's story, as a last ditch resort, I went to a chiropractor, which I come from a blue collar family. Chiropractors aren't real doctors, they're quacks, they're snake oil salesmen. But I went, and I consider it a divine intervention that I went to a chiropractor, and within 2 weeks I was up, I was walking, and weeks later I was feeling back to myself. And at that point I was like, you know what? This Someone's trying to send me a message. Wasn't meant to go to physical therapy school. I pulled all that and applied to Parker University in Dallas, and the rest is history.
Awesome. Yeah, I think it is so cool when you have your own story and you can relate to people, even if you're not telling them your whole story, just the empathy and the care that you bring when they are looking at that last ditch effort of saying, I do not like where my life is going. Is there anything else?
Yeah. But even circling back around to our previous topic, I'm finding it a lot, and I'm very young in practice, but a lot of people almost get to that point where, I mean, let's be real, we're not the first doctor they've seen.
Right.
And they start to, what I mentioned earlier, identify with their diagnosis. And
Yes.
so it's very weird psychology behind it, but it's like as soon as they actually start to get better, they almost have a freak out moment because they thought they would have this the rest of their life. And it's almost like they don't know how to deal. But
Hmm.
that's even more so when you love on them even more and be like, hey, like, I know you're used to this, and I know that you thought this would be your life, but we're committed to making a difference for you. And we hope that you're committed to stay the course and make sure that this is long-term results and not a flash in the pan.
Yes. So I do want to ask, what do you wish that more people knew about healing in that journey, that continuing aspect?
I would say, just once again, not to beat a dead horse, but it's we live in an instant gratification society. And so I think a lot of people struggle with getting healthy as an active process. They would rather take that pill and just put a band-aid over a bullet wound. But we all know that whenever that pill wears off, the problem is still there. And that's what's great about chiropractic care, is we're addressing it at its source, right? We're trying to get the body to do what it does best and heal itself. The problem with most people is that they don't realize, those football injuries, those practices, the wear and tear, the blue collar, not really doing ergonomic activity for hours on end each day. It's not bending over to
Mhm.
unload the dishwasher. That fork did not cause your back to go out, right? I work with guys that could be on the cover of Men's Fitness magazine and bend over to pick up a pen and their back goes out. Now, these
Yeah.
are guys that could lift the world, right? But we both know that the weight of the pen didn't cause that. It's all the life events that built up to that point, to where an everyday activity caused, no pun intended, the straw that broke the camel's back, right? And that I am not undoing the event of you bending over to pick up that fork or grab that pen. I'm trying to get your body to heal from the 4 decades of activity that led up to that event.
Yeah.
Like, I can get you feeling better in a couple of visits. That's no problem. But I don't want to be a flash in the pan. Like, I want long-term change, and that takes time, repetition, just like getting in shape. You don't go to the gym one time and come out looking like Thor, right?
Yeah.
As much as Dr. Kira would love that,
Me
but
too. Yeah.
process, time, and repetition.
I think that is cool where you do have that fitness and physical therapy background where you can remind people of that. Like, even, me, so I'm almost 40, 4 kids later, yes, I would love to think that I could just go to the gym for 2 little workouts and be amazingly fit. And it's like, that's a good thought. But, like, yes, it has benefits for those 2 little workouts, but it isn't the long term wellness. Like, if I do that, like I was doing that in the spring and haven't been all summer. So, was that beneficial to get that relief and to start feeling better? Yes. But if I don't continue, and if I'm sitting at a desk a lot, well, actually, I'm trying to stand. But, if we don't continue these efforts and get to the actual, yes, healing level that we are wanting to achieve
Yeah.
and beyond it, because I think a lot of us do sell ourselves short on, I'd like to feel better. And then it's like, you're selling yourself short. Imagine how you could function better.
Yeah, absolutely. It's all about not feeling, but function. Like, obviously, I have a heart. I want you to feel better, but that's just fleeting, right? I mean, if I go out and chop a whole bunch of wood or bale some hay, I'm going to feel it the next day because I was active, right?
Hmm.
So if we just base off of feeling, that's a problem because we want you to be able to handle the day-to-day grind and be able your body to handle that, and keep going, right? Not
Yeah.
always be hovering at the point of being broken down, right?
Yes. Well, and how many really serious things can be happening in our bodies without us feeling it and realizing it? There's so many tragic stories of,
Some of the
heart
worst
attacks.
health problems, heart attack, cancer,
Yeah.
those ever will cause a nociceptor to fire, right? It's
Hmm.
just when it happens, or a lot of times, like with cancer diagnosis, they stumble across it because they take imaging because someone doesn't feel or something doesn't feel right, and they stumble across it, right?
Yeah.
Or they did a panel, like a hormone panel, or something chemically hormone, something's out of whack, so they go into imaging. But some of the worst things that happen to the human body will never fire a pain receptor.
Yeah. Okay, I really love that phrase, never fire a pain receptor. Yes. And that is also why, whenever we're talking about things, I'm a mom. And so when I go back to what can I do for my kids to set them up, like you talked about 4 decades leading up to, and it's like, I would love to see my kids 4 decades leading up to being awesome.
Yeah. Well, that's why one of our personal mottos here in this office and I got this from my mentor, Dr. Michael Viscarelli, is just, healthy kids become healthy adults. We can't stop life from happening, but what we can do is set them up for success to where, say they have an acute problem, a health problem, we don't let it become a chronic problem. A lot of
Hmm.
the general public is like, why would I bring a child to a chiropractor? It's like, well, we're being proactive with their health, not reactive. All right. We're not waiting until they're in that hospital bed to go, maybe we should do something about this. It's like,
Right.
do everything we can to make sure they don't end up there.
Yes,
Right.
absolutely. Yeah, and those small things that then, yeah, just left unchecked
Yeah.
just become such a bigger thing. Well, I think we could keep talking about this for a long time. I'm gonna
I
put
have the
more.
gift of gab. I can talk
Yeah.
all day long.
Yeah, well, me too, especially when we're talking about things that really matter and they matter to the health of families and communities and ultimately the whole world because, you think about each kid that then goes out and is, happier and better able to function at school, each dad that is then better able to care for his family, to, function in communities and give back and maybe then he's like, yeah, I could coach the soccer team because he has margin. Each person then is able to affect the world. So it is what really matters. I'm on the internet all the time, and there's a meme that says the only things that really matter are like your health and your time, and you invest your time into your health, and health will give you more time. So, yes, thank you for everything you're doing, and thank you for sharing all of this today.
Yeah. One of my favorite quotes that I've got from another person in a medical field that was actually just strictly dealt with cancer was, and I really want to get this across to most people. It's like, if you think paying for health is expensive, wait until you pay for disease.
Right.
And another thing that I just, to all moms out there, is I always say, fight that mom mentality of, I will take care of everyone else. I will devote everything to the kids, to the household. And then if there's enough time or resources to go around, I'll take care of me. But I always have to have this heart to heart with moms and say, hey, you can't pour from an empty cup.
Yeah.
No one can replace the role that you have in the family. You have to take care of you first, because no one, if God forbid something happens to you, it's like no one else can step into your role and do what you do. So, mom, fight that guilty mentality coming to your chiropractor, because we're making sure you can handle the day-to-day stress so you can be there for your family, right?
Yeah.
That mom guilt, I can't reiterate it enough. I'm like, ladies, I mean, you got to take care of you. You have to. No one can do your job.
Well, that really hits home for me. So I really appreciate you saying that, because it is really true where setting out lunch, like mom's in the summertime and you're setting out lunch, and, it's like, okay, there's leftovers for everybody. And then mom grabs, some carrot sticks on the way out the door, you
Oh,
know?
yeah, I'll just graze
I'll
and
just graze,
hopefully.
yeah. Yeah, awesome. Well, thanks for all you do. I'm going to put links in the show notes so people can find where you are. You're at Green County Chiropractic, yes?
Green Country.
Green Country, perfect. Okay, the dyslexic side of me is like, is there an R there? Yes, there is. Perfect. Well, I love that. So we're going to put the link in the show notes and more information. But thanks for all you do and for sharing today.
All right. Thank you so much for your time, and I hope you have a blessed day.